Hey everybody, so in the last video I talked a lot about this chart right here. So life expectancy versus healthcare expenditure, and it compares a lot of countries that are similar. And so in that video I talked a lot about why we as Americans are on this red line, why we are so much different than all of these other countries when it comes to life expectancy. Why we do so poorly on this chart compared to other countries. And so if you missed that video, I highly recommend go back and check out that video so you can see kind of a 30,000 foot view of why we are so different than these other countries and why we lack so much when it comes to health as a nation. But in this video, I wanted to focus specifically on one piece of this puzzle and why we're so different than these other countries. And that piece is the food pyramid. So I want to cover in this video why it was outdated, even for the time that it came in, and then why it was corrupted, and then why that even happened in the first place. So for those of you guys who are new here, I am Dr. Jake Long. I'm a chiropractor and I practice in Castle Rock, Colorado. And I'm very interested in health. And so part of that is going after what's going wrong in our health as a country. So we'll get right into it. Okay, so the food pyramid and why it's outdated. So the food pyramid was instituted in 1992, and it was even really outdated at that time when it came in because if you look at the pyramid, what's at the base of the pyramid is what's recommended to eat the most of. And so if you just look at the base, they're recommending that you eat the most of basically refined carbs and processed foods, enriched grains and rice and cereals and things like that. And then it kind of goes up from there, lesser quantities as you move up the pyramid. But there's a pretty big problem with what was recommended. So if you eat what's recommended in the food pyramid, what is it going to lead to? Well, it's going to lead to weight gain, it's going to lead to obesity, it's going to lead to a rise in type 2 diabetes, gut issues, all sorts of inflammatory conditions. And that's what we're dealing with in this country right now, and what we're spending the most on when it comes to chronic diseases. It leads to heart disease, it leads to a lot of these things. And so that's a pretty big problem. So it was outdated even for that time because science was suggesting, even at that time, that fruits, veggies, high quality proteins and things like that were supposed to be the base of the diet, and then it moves up from there. Even at that time we had science that was supporting those things. And so number one, food pyramid is definitely outdated, and they've since updated it since then in 2011, and we'll go over that in the next video. But even at the time in 1992 it was outdated. And so number two, it was corrupted. So food lobbyists, agricultural companies, and then grain companies and sugar companies all lobbied so that they could get their food recommended in the USDA food pyramid, because it was recommended to millions and millions and millions of Americans, and millions of Americans were influenced by the food pyramid because that's recommended from top down what we should eat. And so they lobbied, which, I mean, if you think about it as a business, it's a pretty good model. You just lobby and get your food recommended to all these Americans, and then you're going to sell some more food. So that worked for them as a business, but that did not work for us in terms of health as a nation. So lobbying and all that kind of thing really influenced the food pyramid when it was instituted. As well as in the 1960s, there was a study that they did on this time period, and they found that the sugar companies actually paid researchers to diminish the role that was expected from sugar in heart disease and things like that and chronic conditions. They actually paid researchers to diminish that finding and then blame fat instead. So they paid researchers to skew the research in favor of sugar, or to say that sugar is maybe not that bad, but that fat is bad and fat should be demonized and fat should be avoided, when in reality we know that that is not the truth. Okay, so quick side note on the base of the food pyramid. So it doesn't seem that bad if you just look at the pyramid, because they're showing, you know, a loaf of bread and rice and cereals and things like that. It doesn't look that bad, but in reality, those foods are the most compromising when it comes to our health. So those are the foods that it's not just, you know, like your grandma's loaf of bread. This is factory made, processed food, ultra processed a lot of the times, where it's got not just bread in it, it's seed oils, there are added sugars in there. So, I mean, sugar company paid to help you to think that sugar was not that bad, so remember that. So sugar's in there, and then they have all of these refined carbohydrates, and so even the wheat itself, in a lot of these things that are recommended, were stripped of their original nutrient density. And so if you don't have whole wheat, then it's not really wheat. It's been stripped a lot of its nutrients, and it's not nearly as nutrient dense as it would have been if we kept the whole wheat plant. And if it says whole wheat as the first ingredient, you're in a better spot than if it says, you know, enriched, ultra processed, refined wheat and flour and things like that. So quick side note on that, a lot of those foods are just baked. I mean, if you just grab most of the things on the shelf in a grocery store, what it says on the front is not what it actually is. When you turn it over on the back and read the ingredients, a lot of those, there are paragraphs, plural. There are many paragraphs of ingredients in them. There's all kinds of things that they throw in there to help for stable shelf life and things like that, that actually deplete the nutrient density of that food, increase the calories a lot of the time, and then make it for a really tough time for your gut to be able to handle all of those ingredients. It's not as simple as it used to be. So, third section of this video, why did this happen? So how did the food pyramid get so corrupted? How did Americans' health get so impacted by this? Number one, there was obviously a profit over health agenda when it comes to the food pyramid. They were more worried, obviously, about making more money, selling more food, than they were actually about creating a healthy diet recommendation for Americans. And then number two, there's political influence in this as well. The USDA obviously has some conflict of interest when it comes to what recommendations that they give to Americans, because they have to give a recommendation that somewhat aligns with where the science is, but they also have to seemingly try to appease these companies that are paying big money to get their foods put in front of Americans as much as possible. So there's obviously a conflict of interest there when it comes to the recommendations that they give. And then number three, they really fail to prioritize the science when it comes to what leads to an optimized life for Americans and optimized health. They obviously did not prioritize that, and instead prioritized profits instead. And so if you're really interested in this topic and you want to do a more deep dive into it, there's a great book that was written by Casey and Callie Means called Good Energy, and we'll throw this up on the video so that you can see it. But this one, Casey and Callie Means are a brother and sister duo, and so the sister, Casey, she went to Stanford Medical School and graduated from there and was in surgical residency, pursuing a job as a head and neck surgeon, which is highly esteemed. She was, I think, maybe the top of her class in Stanford, or really high. So well-educated woman, and a great doctor in the making. And she actually left medical school because she was so upset with the system that has been created when it comes to what actually helps Americans be healthy. So she was really good at surgery, but she didn't know, how to really help people. She didn't know what recommendations to give. And unfortunately, they watched their mother go through a pretty horrific health journey when she was following all the recommendations that doctors were giving her, eating the diet that was recommended, and all of those things. And that led her down an unfortunate path in her health. And eventually she passed away. And so this is what sparked Casey and Callie Means to really come together and start fighting for Americans and fighting for health in general and what makes us healthy and getting that information out there. And Callie, the brother, he was actually a lobbyist for the food industry before leaving and pursuing this more noble path with his sister. So those lobbyists that I was talking about for these big food industries, he was actually one of them as well before he joined forces with his sister and started fighting against it. So highly recommend that book. That's a great way to get an overview of what's really going on and what really would make us healthier. Okay, so that's all I've got for you in this video. So quick teaser for the next video that we'll put out next week. I'm going to go over the new recommendations that the USDA has, and they've, spoiler alert, they have improved their recommendations, so it's not as obviously corrupted as the first one. But I'm going to go over that in a little bit more detail in the next video, so stay tuned for that.